over the weekend, insurers started paying for at-home tests, or you could apply for reimbursement. But Medicare is not. I know that Medicare recipients can go through their doctors, and some through Advantage programs can get reimbursement, but broadly, members of the program can't. And I'm wondering why not. This seems like a group that would be, you would most want to sort of be vigilantly testing before going to gatherings, as they're elder and therefore most at risk for COVID. And especially since you said yesterday that you had all the money that you needed to fight COVID right now, why isn't the government paying for these tests?
Well, first, there are a couple things that are happening. You kind of glossed over some of them, but let me give you some specifics. So state Medicaid and CHIP programs are required to cover at-home COVID tests. CMS has also issued guidance to states to effectuate this requirement under Medicaid rules. There are a lot of people who are eligible for Medicaid out there, just to be clear, and CHIPS program. And people who are covered by original fee-for-service Medicare. Medicare pays for COVID diagnostic tests performed by laboratories such as PCR and antigen tests. For Medicare, we're also continuing to explore the best ways to provide critical resources that will keep Medicare beneficiaries safe and healthy, as you touched on. So in addition to PCR tests, rapid PCR tests, and rapid point-of-care antigen tests are available at 20,000 sites across the country. We've also sent 50 million out to community health centers and rural health centers, but we're also exploring a range of options. So I'm not ruling anything out, but I just wanted to note there are a range of ways that different forms of insurance, even if it's not traditional private insurance, have been covering not just in doctor's office, but also at-home tests as well.
The Federal Reserve issued a report yesterday saying that they're weighing the possibility